Hello.
There you go, honey.
Hello.
How are you?
Hello.
Marvel here.
Yep.
The old man.
Oh, Anne Marie.
Yes.
Do you know the crosswalk that Bethel does in Lewis?
Yes.
Do we need permits
For what?
to do the crosswalk on Good Friday? The church.
Let me check. All
right. Thank you.
Len hasn't even started yet. I had to think.
All right, honey, I think you're good.
All right. Hello, Susan.
I mean, should we? Including face drinking. Yeah, I wanted to talk to you about that myself. Oh, it was just a timing thing. I happened to run into Sharon. We're all in this together. Yeah, I know Faith is really struggling. I didn't expect it to be great, but I was hoping it would at least be normal, and that Faith could be reassured that we love her and that nothing's changed. But I think the exact opposite happened. I think she's the most upset at me because she thinks that I'm the reason for all the problems between you and Sharon. So, what an interesting way to make this all about you. Wasn't doing that. I was just saying that maybe I should talk to her because she'll vent
to me, and maybe I can drop her out. No, I should be the one to talk to her. We don't have to make any decisions tonight. We can sleep on it and talk about it in the morning.
You know, I don't need any more time. Let's do it. That's the way to go.
Are we really doing this?
I think we are.
It's just been such a roller coaster. And the devastation of finding out that I can never get pregnant again. And then now knowing that we can still have everything we dreamed about.
It was quite the gut punch when we got the news, but all we had to do was recalibrate. A couple of times was the situation.
Of course, my first.
Good afternoon. Hello, Bob Fulton.
Good afternoon. Good afternoon. Can you hear me okay?
Hello.
Great, fine. Thank you.
Okay.
Thanks for joining us.
Hey, no problem. Appreciate the invitation. Sit up here.
The construction of the addition to the high school is really moving along. Looks like the
Yes, it is.
pretty well done.
Yeah, it's obviously its original schedule was fall of 21 for move-in, but it will be ready to be used much earlier than that. Maybe April, May, probably.
Yeah, when I go by at night and the lights are on, it's amazing that it looks like it's finished. Well,
Yeah.
maybe not painted, but you know, it really looks like it's moving.
No, we're very fortunate. We were able to do because of one of the benefits of COVID is kind of earlier last year when we kind of exited school in March. Part of this plan was to add on to the cafeteria, to expand the cafeteria out the back. So we were able to do that and get an early start on that board before the summer even, so that when the kids came back this school year, most of that work was already done and we could do it that way. So that worked out well.
Great.
And that's the other part of that was expanding the cafeteria to increase the space in there as well. Yeah. And we've been fortunate, you know, don't take it for granted, but each of our projects have been on time or early and under budget.
The latter part of that phrase is very relieving, I'm sure.
Yeah, good people working, you know, just everybody from the architects to Brian Bassett, a guy who sort of heads our department here, as well as Richard Y. Johnson, who's the construction management company, really has worked out well for us. And we're talking like almost $300 million over the last 7 or 8 years in projects. Yeah.
It's great.
And the extra space definitely came in handy, especially this past fall with the COVID restrictions and social distancing, and having sort of some additional spaces and bigger classrooms and more classrooms available for our students and staff to spread out in. It really did help for that as well. Not intended for that reason, but definitely was a help.
Okay. Hello, Dr. Cowan. How are you?
Ted, how are you?
Okay. How are you today?
I'm great. As it turned out, I tried to log on to the BB governance Zoom call, and I was the only person there. I realized I was in the wrong spot.
There are too many Zoom calls. I think many of us have done that. So.
And a couple different platforms too. We had a call with public health, and we used the Blue Jeans platform, which is what the hospital uses, and they scrambled at the last minute because they use Zoom and whatever the Microsoft product is, but we got to figure it out. Yeah. So I don't see David on the line.
Lynn
Um,
said that he was going to be very time limited. So she said he would be here for 15 minutes, but I don't know if maybe something else came up.
Well, why don't we go ahead and get started?
Sure.
So there are minutes from the previous meeting
Mhm.
that were posted. We need a motion to approve those.
So move.
There's a motion. Is there a second?
Second.
There's a motion and a second. All in favor?
Aye.
Aye.
Opposed? I should have asked if there's any discussion, but sorry about that. So Dr. Fulton, welcome. I'm glad you could join us.
No, thank you. I appreciate the invite. A lot's been going on, and it's nice to finally get a chance to kind of, I know there was another invite maybe earlier in the fall, and we had, a little bit too much going on at that point, just trying to get things opening and getting going for the school year. So it's a much better time now, almost halfway through our school year. It's hard to believe.
Isn't that amazing?
It is. It's amazing.
So when David comes on, I'll let him give us a little bit more of an update with regards to BB. Obviously, with regards to COVID, the focus, the narrative has sort of changed. We are now transitioning from the tracking the virus and its impact on the community. There's a lot more conversation about vaccine administration now, which is a good thing. So we'll touch on that. Just with regards to the numbers in the county for COVID, the number of hospitalizations in the state have declined some, which is reassuring. And the number of hospitalizations in the county are also declining, although we still have a fair amount of people with COVID in the hospital. If you recall, these people tend to be hospitalized for a long period of time. So not many people through the front door with COVID right now, which is good, but we still have a fair amount of them running around. Hopefully that trend will continue. Again, we were concerned in the, roughly speaking, the 14-day period after the holidays, and we've gotten through that. So hopefully the trend will, hopefully it'll continue. The percentage of tests that are positive in the county still remains high. It's right around 11%. The state actually offers two different numbers. They offer the number of people that have tested positive and then the number of tests that are positive. I think when you're looking at a snapshot for how much virus is in the community right now, the number of positive tests is probably a better number. It's an easier number for me to understand or to make differences with. Do we have any questions about where we are from the virus standpoint or comments?
I'm hearing a lot of people who are coming up positive but asymptomatic. Are you seeing a lot of that as well? I mean, I know of 4 or 5 people in the community that have had that result.
So I don't believe it's any more common than what it had been. If you recall, in the summertime, a lot of the summertime Dewey Beach people were all relatively asymptomatic positive.
Right.
So we just know that's part of the disease. And the tough thing is to know, so we see people that are positive and symptomatic, that's easy, but we see people that are asymptomatic and positive, and then we see people that have been symptomatic and have recovered and continue to stay positive. And we sort of struggle with those things and exactly what they mean. The CDC changed their recommendations for repeat testing, especially for employers, because you had these people that were out of work literally for weeks, approaching months, that had positive tests but hadn't had a symptom in 4 or 5 weeks, which is why it's more of a symptom-based return strategy. So we see it. We're not entirely sure what to make of it. Did I just see Dr. Tam? Welcome. And you're on mute still. Hi. So I just gave a quick overview of sort of the stats of where the virus is in the county and the downward trend of hospitalizations. And I know that you're on a tight timeline. So if you want to make some comments, and then we'll get you off to, interestingly enough, your next meeting is about COVID response also. So
Yeah, thank you, Dr. Cowan. I apologize for jumping in and jumping off, but certainly wanted to update all of you as much as possible. The meeting I'm going to go to is talking about vaccinating further in the sense of developing opportunities that that give the maximum impact, bang for the buck, or whatever you want to call it, for vaccine allocation. So, the fact of the matter is, not just here in Delaware, but across the country, people are worried about vaccine availability. There's a lot of work being done, but certainly as part of then any decision made with respect to allocation, this is one of those areas where the distribution process, or the distribution process that maximizes the use of vaccine allocation really are the ones that will get the vaccine, because we want to give it to as many people as possible. And so that's one of the things that we are working on, everything from the community, different venues, as well as, dealing with populations of color. Those are all the things that are being looked at right now. So more to come in this. And I just want to take an opportunity to thank people like Mert, I see her on the call, for always trying to offer up ways to volunteer. And we will continue to work with Mert and people in the community on how to get vaccines out when we can. With respect to the community, very briefly, so the hospital actually had its highest peak in terms of the number of patients in the hospital about a week and a half, 2 weeks ago. We were up to about over 60 patients. That's higher than we had even in the spring. So we were able to manage that well. I want you to know that despite the fact that we had higher patients than we had in the spring, we did not close off services. We did manage that effectively. There were a couple maybe surgical cases that were postponed briefly, but actually we did a pretty good job of making sure that services weren't closed. If you remember, in the spring, clinics were closed, endoscopies were closed, everything was closed. This time we didn't do that. We kept all our services open, and I think that's a credit to the team, and also to the fact that we were able to learn from the spring about how to better take care of patients. For those of you who also know, we've been also giving out monoclonal antibodies, and we're doing a good job with that. I think we've up to about almost 80 to 100 patients that have received monoclonal antibodies here at BB Healthcare, and that's scientifically been proven to reduce progression of disease once you're COVID positive into something that may end up requiring a hospitalization. And that's helped, of course, keep the hospitalization number low. Other than that, I think we continue to now look at today being the 26th of January. So we're kind of coming out of that 2 to 3 week period of time following that Christmas to New Year holiday period. So all of us are kind of holding our breath to see what that will mean with respect to infection rates, as well as then the hospitalization rates. I'll keep you up to date and informed on that. And of course, making sure that, as we now start thinking about when, people getting more interested in getting outside or getting with people as a result of getting vaccinated, we'll just have to make sure that we continue to spread the word, even if you're vaccinated, okay? And I'm sure Dr. Cowan will speak to it much more eloquently than I, certainly more than Dr. Marvel, maybe just as eloquent, that even if you're vaccinated, you still will have live COVID virus in your nose and in your throat. So even if you are vaccinated, it doesn't mean that you won't potentially spread the virus to other people. And that's one of the reasons why, even when people are vaccinated, we're going to have to continue to maintain watching our distance, wearing a mask, or washing our hands. So please make sure that the community knows that we just need to continue doing that until that herd immunity kicks in and there are less people infected in the community. And I'll stop there, except to say one last thing before I answer questions and then also kick off, is that kudos to Bob Fulton. As a parent of a Viking. They did a great job with managing everything from the football program. Always felt very, very comfortable with how teachers as well as the football team and other athletics did. I can tell you, it's not the same in California. Okay, we did it right, and so I know there's always opportunities to improve. But Bob, thank you for you and your team in terms of making it safe for at least my son to enjoy his junior year. So thank you.
Thank you very much. Appreciate you mentioning it.
Dr. Tam, this is Ted Becker. On behalf of the city, I'd like to thank you for all the efforts that BB personnel put forth over the weekend to get the vaccination site operational. I'll bet a little cold over the weekend, but I understand from earlier the conversation you mentioned this morning that there were 60 staff members who volunteered their time to work at that site. A frigid time, but thank you very much. Great dedication on the part of the staff. Really.
Well, thank you, Ted, because it was certainly a partnership. And, Dr. Cowan can speak to the fact that we had the Sussex County EMS people. We had all the people from the Delaware Medical Reserve people working with, like Mert was there, and certainly BB was there. On an anecdotal note, last night I was leaving the hospital around 9:30, and I noticed this crunchy stuff on the sidewalk. And I kept asking myself, is that hail? Is that sleet? And I looked down and I said, why is it green? Turned out to be salt, learning all the stuff of being a resident here in Lewis, but very happy to be here. And I think, Mr. Mayor, we really appreciate everybody in the community supporting the team. They've been working on this, throughout the pandemic, and the opportunity to serve is still something that resonates very much with everybody here at Team BB.
Great, thank you.
Great. Anyone else have any other questions for David? So perfect. So let's talk a little bit more about the vaccination plan then for the community. So as everybody who has not been living under a rock knows, the issue is supply of vaccine. The state is pushing out the vaccine that they get as soon as they get it. It's just the flow of vaccine from the manufacturers is hard to predict. So we have plans. We have plans for large events like we did this past weekend, and we have plans for smaller events as we can, as a supply allows. And when I say we, that really means everybody in the healthcare system. Certainly means BB, but it also means public health. It means the other healthcare systems. It means the pharmacies that are trying to provide it, the independent doctors that are trying to provide it. We all have plans, but we simply need supply. That being said, I'll say the plans, we've never done a lot of this stuff before, so plans change. If you watched the news over the weekend, at DMV on Saturday, we were slow because we had some operational challenges that we worked through. And then by the end of the day, we were able to move participants through much more quickly. And on Sunday, it went much more smoothly. So hopefully every time we do one of these larger events, we learn more about it, about how to flow. And I have to tell you, I've been at BB for 18 years now, and I spent Saturday doing vaccinations, and I have never done anything that was as professionally fulfilling and satisfying as providing that vaccine and seeing the thanks that people had. And these people had waited for hours in their car, and they couldn't have been more complimentary, and they just were they were wonderful. And it was a great way to spend a day. So kind of the vaccine stuff as you can find it is my advice for anybody in the community. And I would look kind of everywhere. Certainly the hospital, you can sign up with us, you can sign up with the state. If any of the pharmacies occasionally have stuff, I would recommend that you kind of look for it wherever you can, because the supply is at this point sort of trickling in as opposed to flowing in like we would hope. So when the flow of vaccine is much more regular, I think we can get a lot of people vaccinated in a short period of time. I think we sort of have that infrastructure.
Dr. Cowan, in reference to that, I'm getting questions from people who went up to Dover weekend before last, and they got the vaccination for the first dose, and they were not given any advice on how to get a second dose, other than not even the scheduling of an appointment. Just said, come back in 28 days. Has there been any discussion that you're aware of statewide about how those people are going to get? Are they going to get notified, or would they need to go find it on their own? Have you heard anything?
So the people that got the vaccine, certainly in Georgetown this weekend, were asked to provide a phone number and an email address. Right. And we were told that the state plans to contact those people in sometime around 28 days to work on a second dose. I think given the supply chain issues with the vaccine, my advice to everyone that I provided the vaccine to, and this is just me speaking for myself, was that if you have the opportunity to find the same brand vaccine, in this case, we were using Moderna, so at 28 days or some period after that, I would find it wherever you can. So if for some reason your doctor has it, or the hospital has it, or one of the pharmacies, get it where you can get it. Okay. The other thing that has changed with this is on Thursday, the CDC has sort of changed their recommendation, their stance, if you will. So the Pfizer vaccine was recommended to have a second dose, the booster dose at 21 days, and then the Moderna at 28 days. They now have pushed that recommendation out for both of those vaccines out to any time within 42 days. So no sooner than 21 or 28, but up to 42 days is thought to be safe. And I think they did that, quite frankly, because they understood that every corner of this country, and really every corner of the world, is clamoring for vaccine. And at this point, just two vaccines in this country. And,
right.
Johnson & Johnson, which is maybe the next pharmaceutical to bring a vaccine to market here, is probably still 45, 60 days away. That's a ways. So we're going to be with Moderna and Pfizer here for a prolonged period of time, I think, or at least in the near term.
Thank you.
Yep, you're welcome.
Dr. Cowan, we were notified, I guess yesterday, that the emergency responders who received their first dose of Moderna and should be right about due for their second dose within the next week or so, were told that they're going to have to wait. If they are able to, should we recommend to them that they contact their pharmacies and see if they can get it at that 28-day mark, or should they just be patient?
Right. So, I think generally speaking, and this is true of everybody, not just first responders, but if you can find your brand of vaccine at a time in which you should get it, I would get it. There's no doubt about it. The state's plan with the first responders is that they will hopefully get that vaccine at some time in the near future. It's still a priority for public health to get vaccine into those providers, but it's just not going to be the 28-day point. You're correct. The earliest emergency responders in this county, I believe, their 28th day was yesterday. So they began to look. So you're right. So people are they're entering into that period between 28 days and 42 days. I think the state has said it's going to be delayed, but they're still going to prioritize them. So.
And what happens if it gets to 43, 45, beyond that 42-day mark, and people still can't get it?
So, that's a science question, and the science question is, at this point, we don't know. What we know from the studies is that 2 weeks after that initial dose, for instance, for the Moderna, you had an 80% chance of not developing detectable disease. You still potentially could shed virus, which is why we still wear a mask, but about 80%. But that was at that 2-week mark. We don't know what happens to those antibody levels as you go farther out. But this is also changing every day, because these questions have been kind of asked all around, all across the country. So people are researching all the time. So every day, every other day, I'm reading kind of meaningful research about kind of what happens if we're not able to be right on the for Moderna, the 28-day mark or the 21-day for Pfizer. We're kind of working through that as a healthcare system because we realize that has become a sort of a reality. Any other questions with regards to where we are?
Looks like Susan's got a question, but she's muted.
Unmute. Now can you hear me?
Yes.
Okay. What happened? So is that first shot wasted and you're going to have to start all over again?
The current recommendations from the CDC, no, you would get the second dose when you can. The utilization of a booster dose is pretty common with other vaccines also. And you get a little bit of a different immune response when you get the second dose. And the second dose really helps you with more long-term immunity. So if at this point we know about 42 days, we don't know about a period longer than that, but I imagine that we are going to find out about that. But at this point, the answer is no. If you somehow end up being outside of 42 days, then you would theoretically just get the second dose. And then that's the current recommendation. That's a short answer.
So should some of us just wait a few more weeks to even begin it so that we maybe won't be on the short end?
No, because you get some very measurable immunity to COVID virus after a single dose at the 2-week mark, depending on which virus you get and sort of, how they calculated stuff. You can get, immunity, the Moderna up to 80%, in the 50s for Pfizer after the single dose at that point. So you have some degree of protectivity for yourself at that point. So go ahead and do it because that's what you care most about. And then you just have to stay vigilant about getting that second dose when you can. But I would encourage everybody to get it sort of as soon as they can, and then to stay on it for the second dose. It's a difficult situation, no doubt.
Hi, Mert.
Hi, am I?
Yep.
Doctor, as you, I've worked now 2 of the DMV in Dover and in Sussex County. This weekend was certainly very different. The temperature made great differences. So are they thinking, like Sussex County, what we keep speaking of over here in the Lewis area is we're very willing to become the Eastern Sussex County operations. And I know last week I did receive one phone call from Diane to say, we're considering it, we want to be the partner with BB, etc. But we certainly saw that the temperature for these outside drive-bys is a contributing factor for the staff doing it and for the vaccine itself. So, has the state entertained anything like using the cheer centers? The superintendent says,
schools,
the high
schools,
school
gymnasiums. Yeah, sure.
I was going to say your school gym, sir. I didn't know who was going to say it while you were on the line, but I decided.
Yeah, no, that's fine. I don't mind at all.
I got a call this morning and they were like, here in our state, I have friends all over the country and they said they're using the school gymnasiums, it works for voting.
We definitely would offer that to be absolutely no cost. If there are custodians involved, we would cover the cost of any custodial cost to get things up and going or unlocked, whatever the need is. We're actually going to be having hopefully an event at our high school this weekend. Educators received emails in the state this morning about vaccines, and I've offered as many times as the state wants to use any of our schools for sites for educators, and they're doing it in 3 stages. 1, 2, and 3, and 1 are older, 65 or older, chronic health conditions, or working with special populations and maybe have difficulty wearing masks in the school setting. So they will be first. And so based on a survey filled out today and the number of vaccines that are available, those who filled the forms out will receive an email tonight or tomorrow morning to let them know the locations, possible locations and times they can sign up. There'll be one in Sussex County, and it's going to be hopefully at our high school for educators in the state. And we just don't know how many vaccines at this point. I think originally that maybe 1,200 total in the state, and I'm thinking we're thinking maybe 300 to 400 vaccines available for staff, but it wouldn't necessarily just be our staff. That's the thing. We aren't able to do it that way. It has to be, countywide, or even if someone wants to drive from Wilmington, if they're an educator and they're on the list, they can come down here and get it. But I figured the closer the better for our staff. And if there are additional openings, if somebody doesn't show and then make a phone call, our staff can get there quicker to get some of those call-in vaccinations. So we're trying out this weekend. It's going to be inside. We're going to just clear out our cafeteria. It's a really large space. It's more space than they need. We could use the gymnasium too. We have a few athletic practices which could move to our middle schools on Saturday, but there's no need because we have plenty of space in the cafeteria and everything they will need. So yeah, if there is an opportunity, we're glad to partner with anybody to have space, whether it's parking lot space or in the wintertime, inside space as much as we can.
Great. So Mert, thanks for the question. I was on a call with Diane Hainsworth, who you alluded to, looking for additional sites here in Sussex County going forward. So the short answer is yes, we've identified both some sites for walk-up within the county that have, and we did this in conjunction mostly with DelDOT because of the sort of the transportation flow issues, and with some of the school districts looking at flow for walk-ups. We've also looked at some potential modifications we could have made to the DMV lanes to make the vaccination experience for the vaccinators a little bit more palatable. It sounds like we could have made those inspection lanes a little warmer, which would have made it easy. The difference between walk-ups and drive-through is for Bob, for your people, for teachers that are otherwise ambulatory, it's pretty easy. You just kind of, walk in the front door and you can walk out the back. But if you looked in the cars this past weekend, a lot of those people weren't terribly ambulatory. And if you get them to a site where you're going to ask them to walk, from a parking spot into a building and out, and that becomes a 200 or 300 yard journey over a period of time, even if it's over a period of an hour, that's a lot to ask for our most at-risk population right now, which is really in those 1Bs, those people over 65, but those people that are well past their 65th birthday with some significant health disease. So it's going to be a combination of kind of everything, and it's going to be based on certainly weather. It's also based on the amount of vaccine and sort of the target population of who we're trying to vaccinate. But the short answer is yes, we have looked for other venues sort of around the county where kind of appropriate. So certainly Cape is one of the high schools that DelDOT really likes, just from an access standpoint. You can have people come in off of either Kings or Savannah and leave the other way. So as I said, at the end of the day, this is about a phone call from the state saying, hey, we've secured vaccine, right, and based on the level, what we can pivot into. Bill Chasnoff, who is one of our infectious disease doctors at BB, he's also the medical director for our COVID response, has developed a multi-tier plan where if we have vaccine, if we have 100 doses of vaccine, how we manage it, if we have 1,000, how we manage it, if we have 3,000 or 5,000 doses, kind of our response to it. So the great thing about BB, and David's gone now, but as we put together the vaccination event at the DMV, I also work for the state as a medical director, so I work with Diane Hainsworth all the time. So she called me as she wanted to do this thing at DMV, and she asked me about BB's willingness to participate, and David didn't flinch. He said, "We'll be there," and we had. So that's 120 people that volunteered their days off to come in, and it was tough for them because they're all indoor employees. They're used to working inside. I worked with the county paramedics there, and they're used to working out in the elements. It was a little bit easier for them. But as I said, we can make that DMV site a little bit more palatable for our volunteers. And that has some benefits because of the drive-up nature of it. But I do think we're also going to need scalable walkthrough places. And I certainly think about some places on the eastern side.
I'm sorry, one last comment, but I'm going to make sure it's into your brain cells. Because I did mention this to Dr. Chasnov, and he was like, I like that idea. It's like, how do you get to the really, really homebound? And again, home care operations, BB has one, but you only know your patients currently in service. But Meals on Wheels knows who's really stuck. And, you know, I mentioned it to him last week, and I said, you know, through the Medical Reserve Corps, you know, here in this community right now, just because everybody reaches out to me for this potential plan.
Yeah.
We have, I think there's 21 vaccinators, and most of them I said, think home care, would you be willing to follow a Meals on Wheels car, go into that home, again, very tightly controlled, but you report, you get your fistful of vaccines, and you follow the Meals on Wheels person, go in, you know, administer, watch them. I agree with you. Like I say, I couldn't help too many more people out of their cars with their oxygen on to get their 4 layers of clothes off and then steady them with the paramedic person so they didn't fall over while I was giving the vaccine.
Right.
There are more and more people, and they're not going to even bother about this, but you know, because it's too much to bother them. So that was just a thought. Meals on Wheels.
I think it's a great thought. The logistics side of me thinks about, of course, you know, every time you open a vial, you want to make sure that you've got, you know, we get 5, actually 6,
right.
or 10 out or 11 out of Moderna. But yeah, I think that's a great idea, especially for those most at risk. This past weekend, as I looked into a lot of cars, I saw a lot of people that were being driven by somebody else. And my thought was, gosh, you never would have gotten here if it wasn't for your. And interestingly enough, I saw a lot of children of people that were getting vaccinated, and those children were old enough to be vaccinated themselves.
Right.
I mean, so this wasn't a over 65 event largely. This was an over, you know, this was the greatest generation kind of event. So,
Right. And Diane made it very clear to us in morning briefing Saturday, you know, no matter how many people are in the car, you've got to have that registration. You must see that you can't. And you know, she said, it's going to be hard, but you have to say no. You have to say no. So that was the instruction we were given, which was the hardest part of the day.
Without a doubt, I think there's certainly, you know, we just had a limited number of doses and we had appointments.
Sure.
So
it is what it is. Like you say, you've nailed it. Vaccine availability. I just keep saying there are grassroots people, and Dr. Chasnov is very clear. He's like, we're going to come from here and we need the connectors down here. So, you know, I just keep telling all the nurses, you know, sign up through. Do you, and I'm not sure if you can answer this question, do you ever think that the state would cordon off, like you become a little chapter for a while? Like the Red Cross is huge nationwide, but they have very succinct chapters, same Meals on Wheels, etc. Would they cordon off if we agreed that here's a captain or a team leader, you know, you be responsible for this service area, we'll get the vaccine to you, you take care of the operational logistics, the volunteers must be registered with Medical Reserve Corps, but we log them in and data enter, do the, you know, give us the forms and we'll manage a team, if you will. And that team is local to a service area.
So I don't know the answer to that. And the reality is that I think that we have not utilized the Reserve Medical Corps, at least as far as I'm aware, to this magnitude before. Mm-hmm. And these are the kind of unfortunate events that allow you to kind of push the boundaries of what you do. Mm-hmm. And quite frankly, the state and the healthcare providers in the state are going to need every hand they can get. So however they can get it. Mm-hmm. I think it sounds pretty
close last week to saying, I'm going to dub you a, you know, I mean, she's a paramedic and, you know, we both are from the Maryland area. Like I say, 9/11 happened to us. So, you know, the world changed pretty fast. And we learned, as you said, to do things you'd never, ever thought of doing. And I said, I come now from that background. So team leaders, team captains, here's your service area, make it happen.
Yeah, you probably would need a partner with somebody who can store your vaccine.
Yeah.
But yeah, definitely.
All right. Thank you.
Yeah.
I'll stop now.
Looks like Nancy has a question. Nancy, you got to unmute yourself.
I have two things. One, just to ask whether there's any concern about an indoor event, vaccination event becoming a spreader event. And the second one is, how do those of us who, perhaps could handle clipboards or check people in, obviously can't inject people, but how do we volunteer to help?
So the issue with does a vaccination event become a spreader event? I certainly hope not. And that's actually part of the struggle of doing it, is you have to maintain social distancing. And that creates a challenge, because then you'll have people in line, potentially even outside in this time of year. And again, at this point, since most of our 1Bs are people over 65, that's all part of the logistics of kind of how you can do that. But you would still continue all like the social distancing and those sort of things. So I'm not sure, with regard to your second question about how to volunteer, does the Reserve Medical Corps, do they take
Non-clinical, yes, they do.
They do. I registered as a non-medical person. So when you go in to register, you just indicate that you're non-medical, and you get text alerts and emails when they have stuff. Like it looks like they've got a ton of stuff. I got an email today that they need volunteers at a call center, like during regular work week hours. So obviously I couldn't take that one, but yeah, it looks like they've got stuff for everybody.
Yeah, there were at the event this past weekend, there were, for every vaccinator, it was really most efficient to have a scribe with them that very easily could be a non-clinical person. So it's amazing how many non-clinical people you really need to make these things run. So Nancy, I hope that helps.
Yeah, if somebody has a link, that'd be great. Just send it to me.
Sure.
I also wanted to thank Dr. Fulton for being on today. I'm one of those that's been trying to champion getting more information for the community. Just a plea that what happens at the school has an effect that goes way beyond your parents and your staff and your kids. And to please consider putting out more information about what's going on at the school. Dr. Tam's been one of your champions about how well things are going, but I think there's a lot of people that don't, get the things that go to parents.
Gotcha.
And it's certainly what happens at the school has an impact at the grocery store and all of the places that the rest of the community uses. So thank you for joining us today.
No problem at all.
That was a good article on Sunday about the Cape's response. I thought that showed a great deal of transparency on your part, Mr. Fulton.
Thank you very much.
I think that it shows that unlike other school systems, we're reporting pretty much everything. That's the article meant to me.
Yeah, our numbers are actually, we're reporting more than we're required to the employees and the parents. Everyone understands and knows what's going on. And we have been fortunate that we've been blessed with lower numbers than even expected as far as our staff and our students with positive COVID cases. So that's been, and that's due to a lot of things, one of which is the protocols that are in place and the staff that we have that are really good about following the protocols we have in place to the T, so that we have few as possible cases possible. So that's worked out as well as it could go. And I'm sure there'll be time later when you have questions for me, or I kind of like to just kind of give everybody an update of what is going on. I'd be glad to do that at any point during this meeting where it fits into your agenda and those kind of things. But
yeah,
I do know the event that we're hoping to do this weekend, the way it will be formatted, I'm told, is it will be inside for the vaccination. There won't be any lines. There'll be appointment only based on people sign up ahead of time. And there'll be people in the parking lots with signs indicating what appointment time is due to get out of your car to walk into the building. So that there won't be anybody waiting to get in the doors or waiting for to be called for something. They'll be in their car until signs appear in the parking lot telling everybody this is the 1:15 time, this is the 10:30 time. So those people during that time period can get out and go and get their vaccination. So we'll see how it goes, but that's the thought going into it.
Bob, who's doing your logistics and your vaccination?
Department of Education is handling everything. I don't know who they're partnering with to do that. Christine, I've talked to her this morning from the Department of Education, who's pretty much leading a lot of this. She has contacted us and she's been our main point of contact. So I don't know who else they have. They've talked to us about the possibilities of volunteers, other staff members. Our nurses have been incredible. I mean, we have the best nurses. They've done so much, and their jobs have changed more than anyone this year in our district, as far as contact tracing, is the interviewing of students and staff to find out exactly what happened when there is a case in our schools, just weekends, nights, everything. So they want to help too. So we're just trying to get an idea about what the department needs as far as people to support and help. What we hope to do here this weekend, and hopefully do several times in different schools throughout the winter and spring.
Just from my own experience, have you contacted either the troop or you're in the town, right? So Chief Spell, you're in the town or you're in the county?
County.
Yeah. Okay. So my recommendation maybe is to maybe have one of your school resources officers reach out to the troop, just because those cars are going to create somewhat of a traffic challenge, just so they're aware of it.
Okay.
So it's possible that, DelDOT is amazingly on board with all this stuff. They may actually be bringing people, with Department of Education, where they bring an hour board in or something.
Yeah, we wanted to be, I wanted to be a little more involved with the process, everything from scheduling of the staff and the staff that will be vaccinated, just because of prioritizing. Right now, the staff are self-identifying themselves based on the survey to receive, the vaccination, either during stage 1, 2, or 3 of the 1B phase. I sort of wanted to have a better handle on our staff. Of course, we have a special needs school, a school for autism, that really kind of has gone above and beyond. I want to make sure the people that are in front of wearing face coverings, as they always should, are in the front of that line, who have been doing it since September 16th. So, but the state has taken it over. So I don't know all the details of what they're planning. Luann Hudson is one of our administrators here. She's going to be the district coordinator for hopefully the event that happens here. It hasn't been announced yet. And it's not going to be announced as obviously a public event. It's going to be only, announced to the people who are being told this is where you go if you sign up.
Sure.
But you never know what's going to happen. People see cars and hear vaccination. Next thing you know, we have a parking lot full of people who think they're getting something they aren't.
I would encourage you to ask those questions. A lot of those logistical questions people haven't thought much about, just because, quite frankly, most of us haven't done it before. But that's great that you're doing.
Thank
good.
you. Yeah, thanks.
Yep. All right. Does anyone have any other questions?
No, but I just think you need to be aware of the fact that your first responders feel like they've been left out to dry. We're over the 4-week period for our second vaccine. Others are getting it, and we have not been scheduled.
Yeah. So I know that the state's very aware of the need of the 1A people that need the second vaccine. And they plan to get it when they can. And again, it's not because they are withholding vaccine. They just physically don't have the vaccine, and they're hoping it's just going to be a matter of a week or two before they can begin to roll it out. But as all these issues come, it's a matter of supply, unfortunately. So, but I do know that you are still in the minds of public health. But I do appreciate that. Okay. Do we have any other questions?
Do we have a percentage for our first responders of how many took the first shots, including the police?
I am not aware of an overall number. I think that when I've talked to some different agencies specifically, I believe that number is in the like the 60 to 70% range. Some a little bit lower, some a little bit higher. And that number is a little bit dated now, meaning that, for instance, with the county paramedics, there was some reluctance from a few of the paramedics initially, and within a week or two, they decided they were going to get it. So our numbers now are much higher than what they were initially. My advice to all of the first responders, the 1A people, was that, like, listen, you should get it. Medically, I think it's the right thing to do, but if you think that you're just going to wait and get it at a later date, you're going to find yourself with a lot of other people looking for vaccine. It's going to be physically hard to get. So I was encouraging people to get it when it was offered. So, yep. Okay.
What was the pickup rate on members of the hospital staff picking up, going ahead and getting the backup vaccine? Was it 80%, 70%?
I don't know exactly, but it's in that 70 to 80% range. So, and much like other agencies, we had people initially that didn't get it, that decided a week later they wanted to get it. So I think, as you know, at this point there are, between 20 and 30 million doses of either Moderna or Pfizer that have been delivered in this country, and those are meaningful numbers when you begin looking for side effects, and we haven't really seen significant side effects. The people that had the significant allergic reactions, there's no surprise with any of them. They've had significant allergic reactions to other things. So otherwise, other than the fever and myalgias that people get for 24 hours afterwards, not everybody, but some people do. Other than that, it's been really well tolerated.
Great. Thank you.
Yep.
We want to look at scheduling another meeting.
Yes. So, Anne Marie, you had some dates that were sent to you from Lynn Wilkins.
I did. So we've been meeting about every 3 weeks. So the dates that she sent really start in 2 weeks. So if you want, I can just go through the dates on the third week, if that works.
Week of the 15th, maybe?
Yeah. So he's available on Tuesday from 2 to 4 and Wednesday from 1:30 to 3. That week.
Tuesday the 16th?
Yes.
Okay. Cheryl Hopple, you're on the line. I remember you have some conflict. Is that on Tuesdays?
He's muted.
Yeah, my recollection was Cheryl had something at 3 o'clock on Tuesdays. So I don't know if we should.
It's sorry, I couldn't find my unmute button. It's at 3 o'clock on Tuesdays, but if you guys want to do one, I can find out what you talked about. It's totally up to you guys. If that works better for everyone else, then I can just catch up and read the minutes.
So
you said
Dr.
that
Tam is available at 2 that day.
Okay. 2 is fine in my schedule. Cheryl, does 2 work for you?
Yeah, it works for me because I don't have my next meeting till 3 o'clock with the state.
Okay. Is there anyone else on the call that has a conflict on the 16th at 2 o'clock?
Yeah, I'm not sure that I'm going to invite back for the next meeting or anything, or if you'd like me to come back, but I'm not available that day and time. But I can always get my assistant superintendent to attend if you have questions or you wanted me to come back for any reason. That would be fine.
You know what, for the next couple of weeks, if you get your assistant there, that would be great, because my guess is that I'm hoping within 3 weeks, we're now talking about using some of your buildings. So that would be great.
So the 16th at 2 o'clock is the next meeting?
Please.
And it continues to be helpful to the larger community to have someone tell us what's happening at the school.
Yep.
Okay, great.
Right. Thank you.
Yep. So Tuesday, the 16th at 2 o'clock. All right. Thank you, everyone.
Thank
Thank
you.
you.
Thank
Have a
you.
good day.
Yeah.
Bye.
Bye.